I just talked about the epidemiological changes on oral cavity and oropharynx in the world. What we identify in the studies, there is some transition change in different countries of the world. It depends if the developed country or undeveloped or developing country. The main issue that is oral cavity is in developing country is still high incidence, and oropharyngeal cancer is increasing. While in developed countries like United States, the incidence of oropharyngeal cancer, which is related to HPV infection, is increasing steadily. So the important message is not only tobacco, alcohol related to oral and oropharyngeal cancer, but we have also infection as HPV. And the other thing that we verify that's sexual behavior, multiple partner also is a risk factor for oral cavity and oropharynx because it brings HPV to the oral cavity. So then it can be a preliminary carcinogen for the future oropharyngeal and oropharyngeal cancer. We have to protect ourselves when we do, for example, with multiple sexual partners, we have to protect, use condom. For tobacco and alcohol, reduce the quantity. I understand that everybody used to drink alcohol, but you have to be more careful, you know. And the other problem is the multiple partners. You can have a multiple partner, but be careful, and then be so. We have to be more. I think you have to try to choose with more carefully and take care of yourself, because you have to take care of yourself. Just think about that. Another key message that lifestyle is very important. You have a health lifestyle. It's very important, not only for oral cancer, but for other type of disease like chronic disease. So having a very health lifestyle, doing good diet, exercise. This is a key message that I can bring. And I think also go to the doctor once a year at least, or every 2 years, and ask the doctor to look your oral cavity to do a good exam. So that's avoid you to have advanced oral cavity or oropharyngeal cancer. Yeah, although it's not because it's difficult for the government to establish this type of screen because they have another priorities like breast cancer, another type of cancer. But I think it should start some studies on this, just because most of the oral cavity and oropharyngeal cancer, they are always advanced stage. So the survival didn't change in the last 10 years for this type of cancer in the world. It's not only in Brazil, all over the world, because most of the patients, they are in late stages. You don't need to be a big specialized person. You should be a dentist, general practitioner, and a specialist. Because you know the head and neck surgeon is a very expensive guy. He has to do a big surgery. So I think you can stratify this for all the health personnel to establish some guideline for them, explain, yes.